because of this province I live in and the healthcare system that has let me down. I was 26 and experienced a sudden onset of chronic pain in my left bum cheek. I couldn't fully sit on it, I couldn't lie on it at all, and I had to drag my left leg around to walk. My family doctor gave me naproxen and freehand types of injections, but he wouldn't send referrals to the pain clinic or orthopedic surgeon, so he wasn't going to do anything else, and I got another family doctor. I finally got to see the orthopedic surgeon and go to the pain clinic. The pain clinic did diagnose me with piriformis syndrome, and the orthopedic surgeon began giving me nerve blocks, which were slightly effective. Aside from my chronic pain, I also needed a colonoscopy. I warned nurses that I was on medications that would likely affect my sedation, and they told me, don't worry about it, the anesthesiologist will know. I was wide awake, and I didn't understand why he was starting. After screaming and asking for him to stop, he finally did. I remember just taking a few deep breaths, and then he started again, and I screamed and screamed until I passed out. I suffered panic attacks for nearly 2 years, and it caused me to vomit, shake, and have severe hypervigilance. I lost so much weight. Still getting nerve blocks from my orthopedic surgeon. He finally cut me off after my last one in July. He had only ever seemed interested after I got the nerve blocks in what my job was, what my husband's job was. I had to fight for every single nerve block I got during that time, except for one that they were able to book right after the 4 months when it ran out. Every other one I had to call over and over. Sometimes I would have to wait months just to get it. He retired, but he did end up passing all of his other patients, or a good chunk of them, to between 3 neurologists to get nerve blocks, but apparently I wasn't good enough. But was told that I had to go back into the queue through my family doctor to get another orthopedic surgeon, which could take another 2 to 3 years. A lot of doctors didn't believe me, and with being a mental health advocate and having a history of dermatillomania, a lot of people didn't believe me. And by February, my right hip started hurting. I couldn't fully sit down on my left side, but I couldn't apply pressure on my right hip. My husband and I went to Nevada and paid over $20,000 to get my muscle removed from my left side. It was 90% effective. In November, we learned that we were pregnant, and we were so happy until a week later. I had to go through a 28-day miscarriage, having doctors tell me I was pregnant, that I was not pregnant, and then at the end, when for sure my hormone levels were way too low, the doctor would not, he refused to announce that the baby or whatever it was dead. I had what was called a blighted ovum, where only a placenta forms. And so my hormone had kept rising, but as a disabled pregnant woman, I did not end up getting a bed. I had to lie down in the ER waiting room. Every time I lied down, the cramps would go away, but the minute I sat up, they would come back. I knew that the right hip pain that I was experiencing was from the result of compensation. I was able to plead my case to a local orthopedic surgeon who was even able to look at the video of my piriformis removal surgery. I had scar tissue around my sciatic nerve, and the sciatic nerve itself was pushed aside and deformed. He's like, oh no, you don't qualify for surgery. He put out a requisition for an MRI, and I have to wait 1 year for it. Wait time for orthopedic surgery in Nova Scotia is somewhere between 3 and 5 years. The increase of pain that I feel each month has been stressing me out, because I know eventually, or knew, that my husband and I would not be able to try having kids. I was in such severe agony for 24/7 during those 6 years of piriformis syndrome that we couldn't even try. And nobody thought to check my hips. And by the time I got one hip x-ray in December 2017, it didn't say on it, query FAI, so I never actually got the opportunity to have that checked. The life that I've been working towards and I've been trying so hard to get, it's all gone now. And I know everybody says it, but no, adoption is not a choice. We went through that process already. You can't have any existing mental health issues. Nothing in that process had anything to do with how good of a parent we would ever be, what type of parent, where we thought our strengths and weaknesses were. Our file is on hold because of the miscarriage, but with everything that has gone wrong and now knowing that I've probably had FAI most of my life, I know that they certainly aren't going to accept us. Mental health services have not helped me. I've seen a few people about the trauma. I even had one in the private sector just say that he wasn't going to help me because he was worried that it might bring up a whole bunch of other things from my childhood. Because the system screwed me, other systems are failing now too, and there's nobody around to help. Millions of dollars towards a CFL stadium, the art gallery of Nova Scotia, and a ferry in Maine. People are dying on wait lists. Many people are not getting the treatment they need. Many people don't even have a doctor. This needs to stop so that my story doesn't become yours.